So one thing that people struggle with a lot after they have surgeries, or they tweak their meniscus in their knee, or they've had knee surgery, is knee flexion or knee extension. Most of the time, if after a knee surgery they can't get past about 45 degrees of knee flexion. So there's a couple things that you can do to kind of help get past knee flexion. Because if I can't get past 45 degrees of knee flexion, I will not be able to squat to parallel without my pelvis or my back, most of the time your low back, doing the work for you instead of where your knee should be flexing. So it's a problem because that creates a lot of joint dysfunctions up the chain into the back, and then it can cause pain down the line. So one thing that you can do to increase knee flexion is, first of all, get a pad, stick it under your knee, and then you're gonna get two either dollies, or these are just PVC pipes through here. So first I'm gonna start off on a stretch. So I'm gonna do my left knee. So I'm gonna bring my right leg out, put this toe on the ground. And essentially what I'm gonna do is a couch stretch. But this is, as much as it's stretching out my quad and my hip flexor, it's also stretching out my knee capsule and my knee joint. There. So I'm gonna get that kind of as high as I can. There. I'm gonna hold that stretch for about 2 minutes. So after the 2 minutes are up, you're just gonna be in this nice upright position. Make sure that your hips are stacked under your shoulders, everything like that. What I'm gonna do to increase that knee flexion mobility in my knee is I'm gonna start off by pushing my foot into the wall this way. So I'm taking my toes, I'm gonna push my foot into the wall this way. So if the wall wasn't there, what would happen is I would go here and I would push this way into the wall. So get back into that position. I'm gonna push my foot into the wall that way. I'm gonna start off with 50% of maximum effort there, just kind of pushing my toes into the wall. Now what I'm gonna do with these poles is I'm going to actually squeeze them and then drive them into the ground as hard as I can with both. That's gonna create a lot of tension throughout my body. I'm also gonna squeeze the toes into the ground and drive my right foot into the ground too. I'm gonna push my knee into the wall harder at 60%. Big breath in, keep your radiating tension. Push my foot into the wall harder at 70%. Go up to 80. Then 90. Keep breathing in, keep the core tight, everything's stacked. And then I'm gonna go 100% as hard as I can into the wall for 10 seconds. Now after 10 seconds, what I'm gonna do is I'm not gonna relax immediately. I'm gonna go back down to 90, then to 80, 70, 60, 50, and then relax. Now one reason that you need those percentages and you need to irradiate the tension, push through that joint, through some tension to create range of motion, is that if I'm looking to increase mobility, specifically in my knee joint for flexion, what I just showed you, is I cannot just passively stretch that joint and create active, usable range of motion. I need to irradiate tension, push that joint into a range that it's never been before actively. By that, I will gain controllable range of motion. So that's a good example of how to increase knee flexion.